Hey, this is Chastidy Bode with Village Dermatology, and we're going to be doing some microneedling today. So we have a patient, Alex, and she really doesn't have a lot of, depth to any kind of texture on her skin. She's just really looking for some general rejuvenation, so some tightening of pores, and just overall, kind of tightening and brightening of the skin. So she does have a little bit of pigmentation out across the bridge of her nose and kind of under her eyes, so we'll be focusing on that as well. I'm going to have you just turn kind of this way, Alex, and we're going to start on this side. So you'll see that she does get a little bit of pinpoint bleeding with this treatment. That's something I have people ask me a lot, is do you get a lot of bleeding? I think that makes people nervous, but it's really just pinpoint, and as soon as we wipe the blood away, that's kind of the end of that. So we usually recommend, depending on what you're trying to treat, a series of 3 to 5 treatments with this. I'm going to go ahead and turn this on, Alex, and just make sure that you're nice and numb. Is that comfortable? Mm-hmm. So like I said, you can do anything from general rejuvenation, where you're looking at about 3 treatments spaced 4 to 6 weeks apart, and all the way to acne scarring. So if you have anything that you're treating as far as depth, you are looking at more like 5 treatments, and that's going to be at the same spacing, so 4 to 6 weeks apart. You have about 24 hours of redness with this treatment. We just tell people to kind of avoid the sun. Don't get hot, so no hot yoga, no Peloton bike, nothing like that, for really the day of and day after treatment. So we can come all the way up underneath the eye, which is a great benefit of this treatment, because a lot of people have just little crow's feet kind of around on the side, and with a lot of other medical treatments, it's hard to get that close to the eye area. So if you have discoloration under the eye, maybe it's dark circles, this is great for that because it's collagen stimulation. So that's another name for microneedling, is collagen induction therapy. So it's just really creating little micro wounds in the skin, so your body's own collagen comes in and fills in those channels and essentially resurfaces. So this is putting in about 1,900 channels per second into the skin, so a lot of remodeling here. And you can see she's pinking up just a little bit, but this is really all you get. It's just kind of uniform flushing and just kind of like you went for a run, honestly. You can see sort of under her eye, because that skin is thinner, that she's got a little pinpoint bleeding there. Alex, you still doing okay? Mm-hmm. So something that Alex had voiced was sort of, she gets a lot of congestion in her pore area, and so by just kind of exfoliating here with these needles and kind of cutting down on any texture that might be there, that's going to help prevent future bacteria from getting trapped in those spots. So Alex can just expect about 24 hours of redness with this. It does have a sunburn type quality to it after the treatment, so I just typically have my patient take a little Advil before the feeling comes back, and that's typically all you need. No discomfort the following day. Typically 80% of the redness is going to be dissipated by the following day. We can treat some deeper lines and wrinkles though, so if you're looking at trying to treat like perioral lines, or what we call lipstick lines around the mouth, or deeper nasal labial folds, you might have an additional 24 hours of redness with that if we really have to go a little deeper, but that's typically it. Okay, I'm going to turn it down just a little bit so we can do your lip. Now again, Alex doesn't really have any perioral lines, but this is something we could definitely go into the lip lines, and even the lip itself you can do for just a little collagen stimulation and a little plumping there. People ask me a lot, should I do microneedling or should I do Botox? Like if you have, lines and wrinkles on the forehead, and my answer is both. They work really well together. If you do the Botox, then you're going to kind of prevent that muscle from tightening and creating that repetition of movement in those deeper lines. And then you can work on the static wrinkle with the needling. So they really do work well together, as well as fillers in the lower face. So I'm going to be putting a little rescue. That's going to be her post-care, and that's what she's going to use for today and tomorrow on her skin. And then we do recommend, depending on what you're trying to treat, always growth factor and antioxidants are a good thing. So like a TNS recovery complex, it's going to feed the skin and help you to produce more collagen. And then also retinol. Definitely need to be on some level of retinol to speed your cell turnover and just make these results, kind of maintain your result and get, you know, the most from your treatment. We're finishing up with Alex. Like I said, she's going to have a little uniformity of just kind of pinkness for 24 hours and a little sunburn type feeling. So you can call Village Dermatology and come and get a cosmetic consult, and we can kind of let you know if microneedling would be the best treatment to suit your needs, or if it's going to be something else like broadband light or halo.